I'd like to start by introducing myself. I go by he, him. My name is Juan, he, him. And my role at the United Way of Dane County is as a volunteer council member. I actually joined the committee this year, the council this year, to give back to the community that has fostered my growth and development over time. Um, Madison has been my place of home for the past 25, 30 years that my family has been here, and I've benefited firsthand from these programs. So it's my way of saying thank you and also doing my part in making sure that these programs continue. So, first of all, I'd like to thank you for joining us. This is our first event in 2024, and I'll go through a little summary of the United Way history here. For over 100 years, the United Way of Dane County has evolved to meet the changing needs of our community. And we innovated forward with a plan for community well being, a plan built with our community for our community. This vision for a brighter future focuses on increasing individual and family well being so that everyone in the Dane County area can lead healthy, thriving, and secure lives, making our entire community stronger and better. As Lead United, we cultivate community minded individuals in their workplaces, in our communities, and through our philanthropy. Being part of this donor network provides connections with other committed and engaged community leaders and professionals, and invitations to special events and volunteer engagements, such as this. Most importantly, our membership provides opportunities to deepen our understanding of Dane County's most critical and sometimes less visible issues, such as racial disparities in health outcomes. Our membership includes over 1,200 households who give 1,000 or more annually or commit to our Step Up program, a giving plan that allows you to grow your giving over a period of 3 years. We want to give a special shout out to the Vogel brothers, Stevens Construction, and Hooper for their generous matching sponsorship. Every new Step Up commitment is matched by these funds, which essentially doubles your impact in the first year of your membership. I also want to take a moment to celebrate our membership. In 2023, over 1,200 households collectively raised over $2.2 million, and those funds were distributed across United Way's 67 nonprofit partners and 111 programs that benefited families in the areas of early childhood support, income, education, and health, helping more families get what they need to shift from surviving to thriving, which is essentially our mission at the end of the day. None of this is possible without our members. So thank you for your time, talent, and treasure that helps lift and support our Dane County families. That being said, we know that some of you are not Lead United members. Whether you give, advocate, or volunteer, you are actively pursuing systemic change to address the needs of our community. And we want to extend a welcome and sincere thank you for joining us today. We'll add a link in the chat for more information on Lead United membership, how to get more involved, and how to join our LinkedIn group. Please use that link to fill out our post event survey so we can bring you more content like this. With that, I'd like to introduce our moderator and longtime friend and volunteer, Dr. Corinda Rainey Moore. Corinda is the Community Outreach and Engagement Manager at Unity Point Health Meriter and a total rock star in the community, stewardship and healthcare advocacy. Corinda has served on countless boards, several of which she was the first and only Black woman to serve as chair. She founded Queen Leadership Academy, a program aimed to provide leadership experience to young Black girls at East High School, and was named one of the most influential Black leaders in Wisconsin. on Madison's 365's Black Power list in 2016. As an expert and advocate in her industry, Corinda serves chairs in our Health Community Solutions team to strategically invest dollars raised in our community campaigns into programs that help reduce racial health disparities. Welcome and thank you for your moderation today, Corinda.
Well, good morning, everyone. I want to first thank everyone for joining us this morning and giving of your time as we talk about some of the health disparities in our community. And then we work together to find ways to change some of these disparities. And while Dane County remains a top place to live and raise a family and retire, education, income, and health inequities and disparities remain consistent for our BIPOC neighbors. As chair of the Health Community Solutions team at United Way, our vision is a Dane County absent of racial disparities in physical and mental health, emphasizing a trauma-informed approach. It is important that we work actively to reduce these disparities, ensure that all have equal access to health care. To address this issue, United Way has been investing in 14 local programs that aims to reduce these health disparities, and we measure progress on these disparities through results, through feedback from our users of these services, and our population's longevity and our general health. And with that, I just want to just remind you of some of those disparities because we know that Wisconsin has a tale of two cities. While it is the best place for some to live, it is the worst place for others to live. And some of these disparities are highlighted, and many of you know from the Race to Equity report, which happened over 10 years ago. And then they did a 10-year update this year to inform us of where we are. And not really much has changed in those 10 years. So I'm just going to say the 5-year average in infant mortality rates per 1,000 folks in our community. For Black, it is 10 times mortality rates. And for whites, it is 4.1. And then in Wisconsin, for Blacks, it is 14.1. And then for whites, it's 4.7. And although these averages are for Blacks are similar to national, my question to you is, do we want to be similar to national, or do we want to be a community that is leading nationals and eliminating these disparities? Because we know that the data tells us that Blacks are more likely to be hospitalized for diabetes, hypertension, and heart failure. For in fact, Blacks are 26.3 times more likely to be hospitalized than whites at 2.4, and to be hospitalized for diabetes, 75.2%, compared to whites at 9.3. And when we think about heart failure, Blacks are 129.4% likely to be hospitalized compared to whites in 23 at 23.1. So we know that these disparities exist, but we also know that we can find solutions to eliminate these disparities, which is why we're here today. And with that, I'm here. I'll be introducing our panelists who are not only leaders in their field, but are critical partners in this work and this vision. And as we talk about these partners, as an here to speak on health outcomes for older adults, we have Ashley Hillman, who is the Falls Prevention Program Manager at Safe Communities. And Ashley has over 15 years of experience in working for the health and safety for older adults, increasing community-based care that addresses the BIPOC community. Welcome, Ashley. Our next expert is on culturally relevant care, which is Brandy Grayson, who is the CEO of Urban Triage. Brandy is also a catalyst for community change. Over the last several years, she's been honored as Wisconsin's Social Justice Leader of the Year and Madison Black Chamber's Community Leader. Thanks for being here, Brandy.
You're welcome. Hey.
Hey, good morning. And then we also have Mariela Casada Centeno, who will talk about some of the maternal child health outcomes. Disparities. Marietta is from Being a Star, co-developed Roots for Change Cooperative. This is the first woman and immigrant-owned cooperative in Wisconsin. And in 2019, they received UW-Madison Outstanding Women of Color Award for her advocacy on behalf of disadvantaged populations. Welcome, Mariela.
Buenos días.
And then finally, we have to speak on racial trauma support. We have Cheryl Cato, who is the executive director and a child and family therapist for the Rainbow Project. She also is the president of Women in Focus in Madison, an organization dedicated to helping students of color achieve their dreams through scholarships. And in 2021 was awarded with the Joyce Ehrman Award for her work with young children experiencing trauma. Thank you for being here, Cheryl.
Hey, Corinda, I think Cheryl's having trouble logging in. So until then, we can just have everybody take more time on questions if they want to. So
all right, we will.
If she comes in, I'll let you know.
All right, sounds good. And before we begin with our questions, I also want to encourage the audience to participate in the chat. We welcome any questions or comments you might have throughout our conversation, and we'll collect those towards the end of the program, and then we'll do a live Q&A with our panelists. I want to start with a question for all of our panelists so we can set the stage and learn more about what we're dealing with here in Dane County. So my first question to all of the panelists, you'll have about 2 minutes to respond. So is what issues are each of you trying to solve at your respective organization? And we will begin with Brandy.
I was like, you did send me the questions, but I would say at Urban Triage, our main focus and the problem that we're trying to solve is the I would say the deficiency people of color and specifically Black people feel as a person. So our job is to empower, inspire transformation in people and support them in having a paradigm shift mentally. When you exist, or as someone who exists in the context of white supremacy and racism, it can be quite exhausting, maneuvering and navigating systems, advocating for yourself and trying to do the right thing. And the obstacles are coming your way that are not similar to our counterparts or obstacles they do not have to face. So our job really is to help people transform their minds and develop the tools and skills to navigate the systems in I wouldn't say a healthy way, because there's nothing healthy about navigating racism and institutionalized racism. However, when you're equipped with the analysis and understanding of what's occurring, we find that people are able to detach from what's going on and becomes less about them personally, because as folks, as people, as we grow up in the system, we end up attaching to some of the narratives. We end up embodying these ideas about ourselves, including inferiority. So when we're able to separate ourselves from those concepts, we tend to thrive. We tend to have more success, and we're able to maneuver in a way where the interactions and everyday people activities doesn't seem personal anymore. It separates us, and we can step back and say that really isn't about me. It's about whatever's going on inside of them. So our job at Urban Triage is to provide people known as Black and other vulnerable populations with those tools, at the same time and spontaneously supporting them around housing and workforce development. We really believe in holistic care for the people that we serve. So I say that's what we're up to at Urban Triage.
Thank you for that, Brandy. And then I will have Mariela.
Hi, good morning again, and I hope that you can hear me well. My throat is a little scratchy this morning. So I feel like and a little bit similar to what Brandy mentioned, for roots or for our immigrant Latino and indigenous communities, the most important issue is invisibility. And the invisibility of the lives lived by Latino women, their children, and their families in the county and in the state. In a county where we are close to 7.6% of Latinos, we are the largest minority group in the state. And we have the population change for us has been 45% since 2010 to 2020, but we're still not fully seen. We are not visible in the data. We don't necessarily talk much about infant mortality in the Latino and immigrant community. Those are not data points that make it to the surface. We lack political representation. We lack grassroots mobilization efforts nested in the realities of our families. So we are trying to bring these realities to the forefront, not by being a gatekeeper that will, of somebody or an organization that will speak for the families, but instead we're trying to create spaces where our families can see each other, where they can tell their stories about motherhood and womanhood, where they together and collectively were able to push the systems to be responsive to the nuances of this invisibility in data, in this invisibility in policy decisions, funding decisions, that to make the systems understand that one size doesn't fit all. We are not all created, we're all created equal, but we are not all have the same opportunities in life. We're trying to, as Roots, we're trying to create jobs in areas of maternal and child health for doulas and community health workers with training opportunities that are crafted, designed, intentionally created by the people receiving the services. So we really want the issue of we are not here, well, we are here. The Latino workforce is the one that is in many ways maintaining also the economy of Wisconsin in the agricultural world. And we still have to fight with our nails and our teeth to be recognized as a community that can thrive, that has dreams, that is in Wisconsin, despite the cold, is in Wisconsin to stay. And we are creating our mark in the culture, from foodways to dance and to language, but also that we are there to be respected and acknowledged for who we are and not for what the systems want us to be. So having an invisibility cloak for many, many, many years is something that we really want to remove from our families. That we are here, we need to be seen, we have to be heard with the diversity of our accents and with the beauty of our culture. And we are also part of the fabric of Wisconsin.
Thank you, Mariella. And we know that visibility is an issue, right, in this community. And so we want to make sure that we are in an inclusive environment, an inclusive state, despite who's at the helm of this state in our communities. So with that, I'm going to ask Ashley to tell us your response.
Good morning, everyone. It's an honor to be in this space with you this morning, and I'm excited to share about the work that Safe Communities is doing and also to learn from my fellow panelists. So I appreciate the invite. So I work with Safe Communities, which is a 501c3 nonprofit organization, and we are based off of a World Health Organization model where we look at data in a certain area, and then we build coalitions around the data that tells us what are the top causes of injury death in this area. So for Dane County, the top causes of injury death are revolve around traffic accidents, drug poisoning, suicide, and older adult falls. So what I will be sharing with you all today is the older adult falls piece. That's what I have the privilege of working on at Safe Communities. And I think a lot of people don't realize that falls are the #1 cause of injury death in our older population. And Wisconsin actually ranks #1 in injury-related death due to falls in the country. And our average in Wisconsin is more than twice the national average. So we can have a whole different conversation about why that is, but the issue remains that a lot of our community's older adults are not only injuring themselves, but dying because of falls. So the work that we do is very preventative. We work with community organizations, healthcare systems, EMS, senior centers, and really look at why people are falling and what can we do at both the grassroots level and the systems level to change that narrative. So how are we working with our community partners? Are we being intentional in reaching all of our older adults? I'll talk a little bit more about kind of the work we've done around data later, but I'll just mention that we coordinate Stepping On through Safe Communities, which is an evidence-based falls prevention workshop. We get really great data from that workshop, and what we've learned over the years is that we reach a very certain population with Stepping On, which is a great program, but we're not reaching historically underserved populations in Dane County. Falls certainly don't discriminate, so we need to find ways in partnership with the community and really looking at how do we make programs accessible to all of our community's older adults? How do we provide culturally relevant programming that appeals to all communities? And that's really the work that we're doing, is increasing access to programming and decreasing barriers to participation in falls prevention and balance enhancing programming. So thanks again, and I look forward to the conversation.
Thanks, Ashley. And I'm just gonna say I'm one of the ones that didn't realize how much older adults were falling until, you know, I started working, doing some work in this area with Safe Communities and being in the community and the community health needs assessment that talks about, you know, some of the injury preventions that need to happen around some of these issues, and falls was certainly high up there. So with that, I'm going to ask the next. First, I just want to let folks know that unfortunately, Cheryl Cato could not join us this morning, so she will not be here. But I want to address my next question to Ashley. And so, Ashley, my question to you is, what does it mean to be a part of the BIPOC community in Dane County when it comes to assessing healthcare for folks of color? And so with that, you have about 1 to 2 minutes to answer that question.
That's a really great question, and I'll kind of build off of what I mentioned a few seconds ago, that we really try to look at data to tell us where the gaps are. And as I mentioned, we realize there are lots of gaps when it comes to providing programming for communities of color, our older adult population in Dane County. So, you know, I think one of the things is increasing access, also, like I mentioned, and there's no one size fits all type of program. And I think the sooner we realize that, and also that we need to meet people where they are and not expect people to always, you know, come to wherever we're providing the programming. We've really, I think since COVID, tried to be very cognizant of meeting people where they are and broadening our reach in more diverse ways. So for example, we had the opportunity to work with Newbridge of Madison and their Latino programming at Newbridge, and we offered Activate Bailando, which is a Spanish dance class for balance. So we were able to in partnership offer this program, and one of the things we learned is that transportation is a huge barrier to the people who wanted to participate. And that's something we didn't account for in our the grant that we wrote. So we had to really adapt and, you know, and find a way to meet that need. So if we want people to be able to participate in programming, and there was desire to participate in programming, then how do we make it accessible? And I think those needs are going to vary, you know, based on, you know, where people may live in Dane County. And so as service providers, how do we break down those barriers, whether it's a transportation barrier, whether it's a financial barrier, whatever, a technological barrier, you know, what are we doing to provide accessible programming for all of our community's older adults, and also including those voices in the programming, the people we're trying to reach, we need to be asking the people we're trying to reach, what makes the most sense for you? What type of programming would you want to engage with, to promote balance? Because it's not so you hear falls prevention, and it's not like everyone's clamoring to go participate in falls prevention programming, but how do we make it something that is desirable and easy to access? I think those are kind of the things that we have been focusing on at Safe Communities, and also learning about as barriers in communities of color, that those barriers may be different depending on the location in Dane County. So how do we address that and make programming accessible?
Thank you, Ashley. And I'm hoping that what folks get out of this is that healthcare is not just about the physical health of folks. It's about the mental health. It's also about those social determinants of health also, right? Those things like transportation affects health, housing affects health. So it's all those things that we need in order to be able to live a thriving life that impacts our health. And so I'm going to address the next set of questions to Brandy and Mariella, which is actually similar to Ashley's question. But can you speak on the racial barriers that might impact the level of care someone might receive from your organizations?
Okay, ask the question again. The level of barriers.
Can you speak on the racial barriers that might impact the level of care that folks in your organization might experience?
Yeah, so the racial barriers are the same as they have been forever, which is, historical racism and institutionalized racism. I believe our biggest challenge in addressing most of the barriers we see in systems, whether it's healthcare or mental health or AODA services or counseling, or from education to public school to academia, it's the same all across. And what we see is how do I say this, a failure to develop analysis of the context of our existence. And what I mean by that is that oftentimes we live in our own bubbles. And when we have privilege, our bubbles doesn't appear that the world is so bad, right? You go to the doctor, people are responsive. They ask you how you're doing. They go over and beyond to make sure they're cross-referencing your symptoms. They're sympathetic, empathetic towards your questions and your hurt or your diagnosis. When you exist in the Black or brown body, that way of being it doesn't translate to us. So when people are interacting with us, oftentimes there's this disbelief. And I believe we talk a lot of the data talks about this, and social work journals and all the stuff that we study to quantify what's going on, right? So we're not believed. If we say we're in pain, folks are like, you're not in pain, take some ibuprofen, right? Which leads to misdiagnosis and non-diagnosis. And when things are diagnosed like cancer, it's already too late, right? So in our reality in Black and brown bodies, I say the biggest barrier is our failure to believe that racism is a real thing. Our failure to develop analysis of the impact, like how we're taught and what we receive through our senses, our eyes, our nose, our ears, everything we hear, everything we read, everything we touch, everything in everyday people activities is constructed in a way where, generally speaking, white people don't have to develop a reference point outside of their reality. So they don't. So when it comes to talking about things and creating innovative approaches to deal with what's in front of us, it's like unbelief, like that can't be happening. You can't live like that. People don't treat you like that. No, that cannot be your experience, which then becomes a barrier to address the concerns, right? And also leads to less allocation of resources to support organizations, projects, and initiatives that are rooted in evidence-based models to deal with the issues that we're facing. We often like to put band-aids on it, like, okay, if our budget is 60 million, let's give those Black and brown people $200,000 to their projects and initiatives, which of course isn't enough to really deal with the root causes that leads to these barriers. So I would just say our lack of analysis, and which then leads to how we value different projects, organizations, and initiatives, which then leads to a compounded issue and the status quo way of dealing with things. So we just keep doing the same thing over and over again, expecting a different result, and that result never comes.
Thank you for that, Brandy. And Mariella?
Yeah, it's hard to, you want to digest what the person before you said and like trying to get it to your heart. So, and I have something written here, but like my ideas are, and my lived experience, wants to go rogue. But it's interesting because for us, racial barriers come in layers. So it's not just one thing, right? And these layers are many, and some of them are internalized, right? As people of color, as women, as people from the global South, we have internalized a lot of the lies that we're told about who we are and what we deserve to be and to have and to access. There are some barriers are perceived and some barriers are structural. They are real and they impact our lives. The majority of people, BIPOC people, immigrant families, women experience all of these challenges at the same time, all the time. But often we're not aware of them. And we see them in our bodies as headaches and cancer and cervical cancer and breast cancer, as we see them as trauma. We see them as violent behaviors. We see them as alcoholism. So we have embodied a lot of the harms without being conscious or aware where they come from and what the root cause. So in the case of roots, roots is interesting in multiple ways, and I'm biased on that, right? But in the way that we reside in the intersection of nonprofit and for-profit. So Root is a social enterprise that was gestated and born out of the desire and dreams of Latino and immigrant women that wanted to do something for their families, wanted to do something for their community, while still having the independence to do it their own way. That kind of framework doesn't really exist in Dane County, right? Or where a bunch of women, Latino women, make the decisions with no boss. You are the boss. So for us, that has led us to have a lot of challenges because we are just going against the status quo of ownership, of leadership. Because our work is in the area of maternal and child health, so we always constantly entering spaces of oppression, and where spaces that tend to push back minority and women-led projects. We are always challenged by the conversion of our own minds and going back and decolonize the knowledge and deconstruct the knowledge that we carry within us to be able to create a different path forward in where we are able to make decisions and where we are able to fund and where we are able to come to a white doctor and say, that's not how it is. This is her body, her decision. And trust me, it's really different when it's heard with not an accent than with an accent. So all these little layers that we have to navigate in a day-to-day basis as doulas, as community health workers, as breastfeeding consultants, are layers that really affect our lives, our life well-being. And we have as doulas to protect ourselves when we come out to support our families. The other thing is that when we enter these healthcare establishments, the majority of them are for profit, right? And I always doubt the name healthcare because actually they make more money when people are sick.
Right.
So, and the United States is a really unique case in the industrialized countries that spends millions of dollars in healthcare, while the indicators of health, in particular maternal and child health, are one of the worst among industrialized countries. So the math doesn't add up, right? So it doesn't take a genius to see it, right? So for us, we are trying to create different ways of operationality. I don't know how to say that word in English. It's hard for me, but to construct a different way of health equity, to make it palpable, to make it measurable, and to make it impactful within healthcare systems when they interact with an organization like, for example, like Boots. Then the other layer that we will find for ourselves is working with women where their needs are way beyond maternal and child health, where the intersection of their well-being is in between housing instability, working instability, single moms, not speaking English, no access to healthcare after they're done with their baby, having their baby, because they're going to lose it. Most of them are Medicaid recipients, and Wisconsin hasn't expanded Medicaid postpartum after a year. It's working on it, but we're still not there. So where do we meet these women in the intersection of the storm that is happening in their lives? For us is where we start doing a lot of patchwork, right? And to see what of the priorities is the main priority for today. And tomorrow we can talk about the other one. So we need more sustainability, more really patient-centered care that is not only based in health, but is based in well-being, holistic, comprehensive, and outside the walls of the hospital. It needs to be in the community. It needs to be informed by the families. It needs to be informed by allied healthcare providers and supporters of their health that not only speak their language, but understand their culture, understand where they're coming from, and are able to support them in the creation of a different life in a place that still doesn't recognize them as a fully human, while yet trying to bring hope, trying to bring the possibilities of what if we could do something collectively. So it becomes really confusing and convoluted, right? But that's why my beginning sentence was the layers there are many, and we really need to start teasing them out so we can recognize them, we can address them, and we can provide possible solutions that are different from the status quo.
Thank you, Mariella, for that very thorough explanation. And now what I'm hearing is that in order for this work to continue and to be impactful, that we must listen to the voices of the people who are being impacted by some of this stuff, right? And we also have to be transactional while at the same time being transformational. And when I'm talking about transformational, I mean that we have to do things differently. As Brandy mentioned, we can't keep doing the same thing and expecting different outcomes because we already know what the outcome is going to be. And we don't have to keep doing research either because we already know. We have the numbers, we have the data. We also know that this work has to be sustainable. And in order for it to be sustainable, we have to be willing to invest the dollars where they need to be. And that is really one of the things that I like about United Way is that they're trying to give the dollars to the organizations that are mostly serving the people who look like the people, right? And so for that, we also want the work to be informed by community, because community is where we'll start to see change happen. But the big piece also that Mariella stressed is that it has to be informed by the families, really informed by the families. And in addition to being informed by the families, we also know that we all continue to do this work because we are hopeful that things will change and things will get better. And what I like to say is that we have to carry the hope sometimes, even when the people can't carry it for themselves, until they can carry it for themselves. But it is in the hope that the real work can continue and really we can start to see some transformation by getting at this steps at a time. We know that we didn't get in this predicament overnight, and so we know that it's going to take some time to do it. But we also saw from COVID that things can change quickly when we want it to change quickly. And so with that, I'm going to ask one other question of you all, and that is, can you all provide an example of a family or individual that required services beyond what you could provide, and how you have worked with other nonprofits to provide wraparound support for these families and individuals? Because that is what it takes is the collective of all of our work. And so we'll start with you, Ashley, and then we'll go to Mariella and then Brandy.
Yeah, I think everything is more complicated than we realize. I think, it's easy to say when we think about falls specifically, oh, well, just how do we prevent them from falling? Like it's just one thing, and it's never just one thing. It's multifactorial. And as Mariella said, having patient and family-centered care is so important in all of the work that we're doing in the community. And a lot of the work we do, it is in silos. And so that's one of the things we have in Dane County, a Falls Free Dane Coalition, and it's comprised of people in healthcare, older adults themselves, the ADRC, EMS, public health, United Way. And it's a really diverse group of service providers and also individuals. And I think this work can't be done by just one organization. So Safe Communities can't just do this on our own. So an example to your question is, someone might call me and say, I'm worried about falling. I had a fall and I'm just not sure what to do. So, we asked a series of questions about the home. Home safety is a huge predictive factor of falling. Vision, medication. Have you talked to your pharmacist? And then also strength and balance. So I can't provide all of those, in-home assessments or services on my own. So I rely on our entire coalition. So I might reach out to a physical therapist and say, hey, can you provide some advice on strength and balance exercises? And then reach out to an occupational therapist on our coalition and say, can you do a home safety assessment? There's an organization in our community that offers free home safety assessments for older adults. So I reach out to them a lot. And then oftentimes it's not just a balance issue, but it is a part of a larger health and wellness issue. So then talking to, healthcare, have you talked to your primary care provider? Do you even have a primary care provider? I mean, it's just layers upon layers of unraveling all of these layers to try to get at the root issue to then try to prevent someone from falling. So I guess to answer the question is our entire coalition, we depend on all of the partners at the table to provide what would be wraparound services so that people, their health issues are addressed in more than just one way. So we can get a home safety assessment. We can get maybe someone plugged into a community class or have someone come meet with them. EMS gets involved. They have community paramedics, so they come and can work with people. So I think it takes all of us, and it takes breaking down silos, the silos that I feel like we're so used to operating in, to really start meeting the needs of our older adults. Because we all have the same goal. We all want people to stay healthy and to be upright and independent and not fall. So we need to work together to make that happen. And I think it's just easy to get in your own little, your narrow little bubble and not do that. But I think, the beauty is working together and starting to break down those silos to help the individuals we're trying to help.
Thank you, Ashley. Mariella.
Yeah, well, Ashley was talking. It's interesting because the roots workforce is on the community. So we are in the neighborhoods, right? So one of our biggest partners are the underground connections of and sometimes that's invisible, right? Invisible
Right.
for funders. I mean, we don't tend to talk about it because they're underground. You don't want to, it's a protective safety net. But our families, the families that we have supported, the families that we have worked with, are our biggest partners because they're having users of the services. They know somebody have been in use of a service. They know how to navigate. They know who to ask for and when to call that person. So many times before even we go to a partner nonprofit, we send our signals on the ground asking for a specific thing. And that happens honestly every day, right? So as Latinas, WhatsApp is everything. It's the way that we communicate, and then we send these signals. And we have found that to be an incredible mine of resource. And it's when when we talk about the invisible, that's something. And I think that it happens with most BIPOC communities, right? The other thing that for us is most of our families require or are in need of support that is just beyond perinatal care. An example that comes to my mind is a young woman. She recently had come to Wisconsin after a long journey. She came pregnant. We suspected that she was raped in the way. She lived in a dairy farm in Dane County, and she was living with 17 men. And so she didn't want to have the baby, but she wasn't able to terminate her pregnancy. And so she decided to give the baby for adoption. Every time that she would come to see us, the only time that we were able to see her was when she was at the clinic, because otherwise she didn't have a ride. And when the person that will bring her, she was really silent. She never really spoke much. So it took a lot of efforts from the doulas to be able to have spaces with her alone. So we also suspected there was either human trafficking or intense violence. So a case like that, somebody that wants to remain underground because of fear of deportation, how do you help? When there is no way that this person can provide any kind of ID to access resources that many of the resources are located for people with a driver's license or an SSN. How do we help somebody that cannot really honestly find another place to live because she can't escape at that moment? So how can you communicate with somebody that doesn't have her own cell phone, that everything has to be coded for us to be able to support her needs? How we did with this young woman, because she was really young, in the process of adoption, right? That was also a really complicated, convoluted process that we realized that women that want to give their baby to adoption are just, or at least how this agency treated her, you are valuable to us until you have the baby. After that, we don't really care about your mental health or anything that happens to you, right? So we had to provide her with a lot of mental health support after the baby was given into adoption. We have a network of clinical psychologists that work with our moms virtually, and she received a lot of coaching. She received weekly boxes of, we have a program with REAP Food Group for wholesome, healthy foods once a week for families within their perinatal phases. We include her into the WhatsApp chat when she's able to get in, the identifying her. And we sometimes you need to know where, in cases that when their violence is in the midst, you have to be really careful how you approach it. We approach attorneys to talk about it, but she really want to remain silent. And until that was last year, this year she still communicates with the doula that was provided support, and she emerges once in a while. We have told her that she's seen to us, that she's heard, and that we are there for her, and she needs it. So she's an extreme case of somebody with a lot of vulnerabilities. But just to give you an example, that even when there is a lot of resources in the county has tons of resources, sometimes an oasis of resources, but you have to tease it out to see the specific population, really and highly vulnerable population, that resources are actually really lacking. So for us, we really need to become highly proactive and creative in how we provide support.
And Mariella, not only do you have to tease it out, these systems are very difficult, even for the most educated of us to navigate, right? And so trying to navigate a system that don't want us to have access either is really a challenge. And you mentioned these underground resources, and there are so many. There are, what I want folks to remember is that these organizations that are working with BIPOC communities cannot do the work alone. There are often underground resources and navigating with individuals, building relationships with other folks that allow them to be able to serve the population that they can in the ways that they can. But I also want to caution, because when we do access those underground resources, we are not nearly telling you what the full cost of helping people cost, because those underground resources don't have costs associated. We're not charging, they're not charging us for the help. They're just helping us out the goodness of their hearts. But if you fully invested so that these folks didn't have to be underground, the cost would certainly be a lot higher to provide the needs to meet the folks. But these are creative ways that BIPOC communities are using in order to be able to help and ensure that folks' lives are thriving. One of the things that we often don't consider, also, that it was talked about, is the mental health of folks, right? Once these traumatic incidents happen to them, or even a diagnosis such as diabetes, when folks get those diabetes of that diagnosis of diabetes or cancer, what does that do to the mental health of folks? And we don't often talk about that, because we know what diabetes could mean. At least in our community, we know that if things get worse, that could mean you could lose a limb, and at the very least, but you could also lose a life, right? And so if things don't get under control, so we know that is there. But the mental health that folks go through when they're processing that news and that information is something that we can't underestimate or understate either. And we have to be able to provide folks with mental health that they need. And we all know that our mental health systems all have huge waiting lists. So where and how do people access those services when they need them? Not 6 months down the road, because we know when folks are ready to accept help, which we know is hard to do, and our community to ask for help, but then to be ready to accept the help. When we know that it has to be accessible and ready when folks are ready to take that help on. We can't be waiting 6 months or a year down the road to get the help that folks need. And so, Brandy, I want to give you a chance to address that.
So I believe the question is about collaboration, give a story about, working with other agencies. Urban Triage works very closely with our homeless population in Madison. Most of our housing work is with homeless families. We had a family of 7, a single mother with 6 children who were living in her car. She was living in her car with her children. And we do street outreach. So we go out into the community to locate families and individuals who are experiencing homelessness, to provide essential services, to build relationships, to connect them to services. Part of our work is working with the Homeless Consortium, which is made up of almost 200 agencies, I believe, who focus is on eradicating homelessness in our area, specifically Dane County. So this particular family, we were able to build a relationship where she felt safe enough to come to our office, because some folks just don't trust systems or organizations. So we built a relationship with her, got her to get to the office. Our staff took the kids so she could get a break, fed the kids, hung out with the children, was able to talk to her about her barriers to housing. And what we discovered is her barriers wasn't as complicated as you may think, or what she perceived them to be. I think sometimes when folks are dealing with compounded trauma and mental health issues, they feel like there's no way out. So our job is to support them in just having a glimmer of light, a glimmer of hope. And sometimes that's enough to break through the darkness. So that was our job in that moment. So what we end up doing is contacting Just Dane, which is technically, like a lot of the agencies we work with, we don't have formal MOUs. It's just we know each other from doing the work. And when there's a gap in services, we reach out like, hey, I have this family. Do you have any resources? So Just Dane was able to assist us in securing hotel, to get them put in a hotel for a week or two. And then we were able to work with some landlords that we have relationships with. So we have a group of landlords that are sometimes willing to accept some of our clients if we have funding to back them. So one of the things that we are able to do is say, hey, we have this family, we're able to cover so many months of rent and security deposits. Can you house them? And landlords would be like, yeah, sure. You're going to pay me up front, or I'm guaranteed the money. Yeah, I'll take them. Which the landlord did. And then we were able to work with Catalyst for Change, which is another organization that does homeless outreach and supports. And one of the things they offer us as part of our just unspoken agreement is when we have folks that need housing, they will come in, and we have funds to back it. They will come in and co-sign the apartments, which also adds another layer of security for the landlord. So we were able to put all those pieces together for her, get her family housed. And then we wasn't able to get secure a 12-month lease because we didn't have 12 months of money, right? But in that 6-month time frame, we were able to work with her to get her employed, and to get her stabilized, get her kids into daycare, get them to school, figure out transportation. And then after that, she was able to pay her own rent. But the challenge with doing the work that in that kind of way is that we just don't have enough resources. And I don't know, and the data isn't coming quick enough as the problem is being compounded, especially in housing. So for MMSD last year, they had 1,038 families that were considered homeless. By last week, they had 1,100 families. So we have a serious problem in Dane County, and not enough funds or resources to support placing and assisting these families. So Urban Triage and other homeless agencies that are doing the work of homelessness and housing stability, we don't have enough funds. And the services that are coming down the pipeline through HUD is offering supports only for families who are living in the streets or in their house, which means that we don't have the resources to help stabilize them before they're homeless, which then compounds the issues because we don't have enough shelters. And once you're evicted and once you're homeless, it's 1,000 times more difficult to get you housed. But if we can stabilize you and provide you with wraparound services, immediate assistance, because maybe someone died, maybe you had a medical issue, all these things that happen when you're surviving poverty, one check away from being homeless. When those things happen, we need to be able to get in there and assist and be preventative versus reactive. And once we're reactive, we're all running around chasing our tail. We just happen to have a situation with with this particular family where things just fell in line, but we have 100 families where thousands of families where things do not fall in line because there's just not the resources out there to assist families.
And what we know is that when you're working with families, situations are often complex, as been mentioned by all of our panelists, and that if you deal with one issue, sometimes by fixing one issue, you can also help stabilize folks to the point where you can then work on some of the other issues, like Brandy mentioned. Working on getting someone stable in housing could also set them on a path to getting stable in some of the other areas where there was quite a bit of challenge. And so housing is the one thing that we know that the average, I think, homeless person in our community is I think they said 7 years old. And when you think about a 7-year-old being homeless, and as Brandy talked about the school population of homeless families, that list continues to grow every day. And so what we want you all to know is that these issues that folks are facing are complex. There are multiple layers to getting folks stable, and it's complexity, and it takes not just it takes a multi-organizational approach, and it takes multi-systems approach, but so we can't just fix it in one quick fix. So with that, I have one question that I'm going to ask all of you all to answer in like 1 to 2 minutes, and then we'll be preparing for questions from our audience who are on the call. So my question to you all is, can you tell us about how your relationship with the United Way makes all of this work possible, in about 1 to 2 minutes? So we'll start with you, Brandy, and then we'll go to Ashley, and then Mariella.
So I don't know. I guess my best answer would be for Urban Triage as an organization. United Way was our first funder, so we were first funded by United Way, and we wasn't actually, we were brand new on the scene, right? So we were brand new, just got our paperwork, and they released a grant, and we applied. And I think the biggest impact that United Way has had on our organization is they took a chance, right? They took a chance on a small-led Black organization that's grounded in transformative education, which looks like agriculture, personal development, parent leadership stuff, all kind of stuff that we teach. And no one in our community was actually focused on that at the time. So they could have looked at our work group and our approach to health disparities and said, that's not familiar, so we're going to do something different. We're not going to do that thing. But they said, wait a minute, that actually supports evidence-based models, that actually supports the data. Yeah, let's take this chance on them, which then opened up the door for other people to take a chance on Urban Triage. It's like once you invest in an organization, in a big organization like United Way, investing in a smaller organization, it also provides legitimacy and credibility to our work, which then opens the other channels for sustainability, right? So our relationship with United Way is so important, and it has always been important to us. So I would say that that's the impact of our work, and the fact that they continue to support our work also allows us to move, like it provides this not additional because we short cash out, but it provides funding that isn't so tight restricted, well, that we could, for our supporting healthy Black families groups, where if we're short in one area, we can move it in the next. So that the flexibility of the funds is also tremendously important to our work.
Okay. And then Ashley?
Yeah, I would echo that, what Brandy just said too, the fact that United Way has been flexible in the funding that we've received. As we started this partnership with United Way many, many years ago, they funded a very certain program. It is evidence-based, it's great, it's impactful. And then as we started looking at the data, as I mentioned, and noticing there are major gaps, and that we need to really make an impact in our community, we need to take evidence-informed practices and get those into the community. So I don't know how many times I've gone to United Way and said, gosh, what do you guys think about this? It's not really what we proposed, but I really think it can make an impact if we just, had these community events where we were really doing targeted outreach and listening also to the community. Over the past couple years, we've been listening a lot and learning what is needed in the community. And the fact that United Way has said, you know what? Yeah, because that's what's going to make a difference. So yes, you need to adapt. That sounds great. Just give us the data that you can gather. It's really helped to elevate our work. And I think, well, I know it, not just think, I know it has allowed us to make a greater impact in the community because we're better meeting the needs of the community. If we just, as I think everyone here has mentioned today, if we keep doing things the same way, we know what the outcome is going to be. And so we have to be willing to try something and maybe fail and learn from that and adapt and then try something else. And United Way has been with us on that journey as we have adapted and maybe failed and learned and then tried to do better. I think that's all that we as a service provider can do is just try to learn, listen, and do better for our community's older adults. So that's the impact that United Way has had. And it's been amazing impact.
Mariella.
So last year, in Dane County, 694 women gave birth. Latino women gave birth in the state, in the county. Out of those, Roots was able to provide wraparound services to 6% of them. It's not a small feat. I mean, it's a lot. When you think that we are 4 doulas on the ground and two doing a lot of the back and research and community-based research and data and grant writing. Of those 6%, 13% were women that were U.S. foreign born. So most of them recent immigrants, which their compounded needs and are greater, right? Because they don't have such a network of support. So numbers don't lie when, well, most of the time they don't lie, right? It's how you interpret them. But for us, the support of United Way for the past almost 4 years is that it provides us the ignition for our week. So it gave us the capacity to lift up from the ground, from the dreams that we had. I was reading a report that we wrote in 2018, just right after Roots got formed, and it laid out the dreams that we had for in the next 5 years. And I almost cried seeing that the investment, it has been great for us, but in the ocean of investment is a grain of salt, right? But to see how much it could be done when the stars align, when you have partners that really are willing to risk with you, when you have data that is becoming more and more innovative and that is telling a different story, when you have a funder that provided you with seed money to really be able to plant a lot of new crops of change. And that's what United Way has been for Roots. A funder that is not really annoying. I don't want to say that, but that is understanding, right? That is understanding of like we're doing the work. Like we want to talk to you. We want to have access to you. You're not some sort of deity there, right? That we cannot access. You are a person. You are an organization that we know your address and we can go to your office. We can email those things that seem like, yeah, they're obvious, right? They're not really obvious for other kind of funders. And I feel like also United Way has gone through a transformation because it also understands that philanthropy needs to change. Philanthropy cannot continue to be so rigid and so necessarily funder driven. It has to be a relationship between the person doing the organization doing the work on the ground, the community that's being served, and the person who had that privilege to have disposable income to provide to their community, because it's at the end of the day, it's an investment in the lives of everybody. And I think that that's something that United Way has, little by little, how I have seen a change in their own narrative, in their own phrasing of things, because words are powerful, right? And also to be able to allow, at least in our case with Roots, the freedom to do with the money what they trust us to do with the money. Is our work speaks up for itself, and we cannot be here where we are right now in 2024 without the support United Way for the past 4 years. And even though the work we feel that just started, so like an exponential curve, right? We are just getting up, so we don't want to drop off the cliff. There's more sustainability and more support that is needed. At least we're now able to expand our wings a little bit, and so okay, we do have some wind under our wings, and have an organization that can amplify the work that we're doing.
So thank you for that, Mariella. So I hope that if you're a donor and you're listening, and even if you're not a donor, but you're considering donating, why you should donate to United Way so that we can continue to offer help and funding to those organizations that are on the ground doing the work for the folks. And the beauty of United Way is that United Way can be flexible and does shift in order to meet the needs of the community. So as the needs change, United Way change. And then giving dollars to folks who are on the ground doing the work, but giving them the flexibility to use those dollars in ways that will be most impactful for the folks that they serve is so important. So thank you, United Way, and thank you all, our panelists. So we are going to now shift to taking a few questions from our audience, and we do have some questions that are already in the chat. And so I'm going to start with one from Andrea, and she says, how can we amplify the voices of those impacted by racial health disparities to advocate for change to happen? So we'll start with Ashley first, and then we'll go to Mariella, and then Brandy.
I think maybe Juan put this comment in the chat. I apologize if I get this wrong, but I think sitting back and listening is a huge way that, as a white person who has privilege, that, I can learn from the community and from older adults who may not look like me, and figure out what's needed and what we can do as a service organization to help. So I think listening and engaging people who we're trying to serve, it's not going to help if it's just a bunch of, people who look like me sitting at the table making decisions for communities of color in Dane County. And I think it's important to engage all of our older adults. We're trying to do better engaging the Hmong community, Spanish-speaking older adult community, the African-American community. And so we need to have all of these voices at the table and to listen. And I think that's one of the first main steps in really figuring out what is needed as far as, coming from a service provider's vantage point. So that would be my response.
All right, Mariella.
So by synergy, it implies that you have to know each other and that you need to work together. And you bring, like a potluck, right? You bring something to drink, I bring something to eat, and we can both have our bellies full. And I think that that's the work of that it needs to happen. Synergy doesn't mean that we're going to be partners in everything, but it could be that we're partners in an issue that intersects our needs. Synergy means that I will trust you and you will trust me. That we're gonna have, if we're gonna have a program together, we're really gonna have a horizontal relationship, particularly when the synergy is from a funder and a grantee, or an organization that is white-led, an organization that is BIPOC-led, because already power dynamics will exist. Synergy means having expectations on the table. What you want from me, what I want from you, and what do we want from us. Synergy requires space and time to build. And synergy can really provide the sufficient collaboration, partnership, creativity that both of people in doing the synergic work could really then amplify their voices, their mission, and their goals as an organization or as people, because you can also become together synergically as people. And it's not a word that should be taken lightly, right? Some partnerships don't have synergy; they have transactionality, which is different. And so I think that is really important that that power dynamics are checked, expectations are checked. What do I want? What do you want? What do we want? Questions should be asked. And what is our structure for this energy? And how we're going to tell the story of this energy? I think that those are important things to ask.
Randy,
What's the question again, just to make sure I'm focused?
how can we amplify the voices of those impacted by racial health disparities to advocate for change to happen?
How do we advocate for voices? I think the first thing we have to do is believe people, and I'm a believer of starting with believing Black people, and that doesn't mean other BIPOC communities' voices and ideas don't count. The reason that I say Black people is because Black people create this dynamic or opposition to whiteness. It's just how our world is kind of it's how we're created. So whiteness in our world is created as this prototype for humanity, and then it's just opposed to Blackness, which is just part of this dimension of relativity that we exist in. Everything has a relationship in order for it to be defined by something. So if we look at our history, we'll find that everything that civil rights movement, all the efforts, revolutionary movements in America has started on the back and the voices of Black women and trans LGBTQIA folks. So I would say starting with just believing Black folks and trusting Black folks to do the work, right? And also believing Brown and Asian folks to do the work, like, because we have different cultural and traditional needs that sometimes isn't translated in conversations. And oftentimes in our work in nonprofits, Black, Brown, and Asian folks are put up against each other to compete. So I also think that we really need to, as BIPOC communities, build our own analysis internally, right? And work together to build analysis, because oftentimes when one group of people speak, we get offended, or we have this discomfort, or we have this emotional response. And what we have to learn to do is sit back, let go, and understand that you've never walked in their shoes. We don't have the same reference points. We have similarities, but through our conversations, I think, as been pointed out, then we could develop that synergy. But sometimes it's really hard to connect beyond racial lines and cultural lines, because we've all been cultivated in this fishbowl that I like to say of white supremacy, which has taught us this binary way of thinking: white, Black, left, right, wrong, and there's no gray area, but their life is way grayer than we think, right? And it's very muddy and it's very messy, but the beauty of life is when you can get through the mud and work through the mud, you find so much beauty, right? So I often compare it to agriculture, because Urban Triage does agriculture, and we, love to teach our people how to farm and how to enter farming ventures. But one thing, if you pay attention to in farming, in order to plant food or to plant a seed to grow, you first got to break up the soil, right? And breaking up the soil is not a pretty process. And depending on what kind of soil you have, right? So once you break up the soil, and I would compare that to breaking down the barriers of oftentimes our culture not understanding each other, then we can plant the seed. And then together we nurture the seed and then we harvest it. And I know people are like, girl, what are you talking about? But I really think we need more communication. We need more analysis building, and we need to trust people who our communities trust to do the work, right? So if our communities trust Latino Academy, if they community trust them to do the work, then we should trust them to do the work. If our communities trust Urban Triage to do the work, then we should trust them to do the work. And not only should we trust them, we should support them and give them tons of resources to do the work, because oftentimes in the work, we're working with $5 and we're expected to change the world. So I would say that's the first step is trusting us. Second step is building synergy, as others have said, and communicating and just building analysis.
All right. Thank you, Brandy. And so with that, I'm going to ask one final question before I turn it back over to Juan. And my final question to you all is, how can partnerships between healthcare providers, community organizations, and advocacy groups be leveraged to address racial disparities in healthcare? And I'm going to say, I'm going to give you all, I know it's short, but I'm going to give you guys a minute to kind of answer that question. So we'll start with Mariella.
Corinda, can you repeat it, please?
How can partnerships between healthcare providers, community organizations, advocacy groups be leveraged to address racial disparities in healthcare?
At the end of the day, you know, we talk about power and we talk about representation, and you know, power can come in different ways and different shapes, but usually it's dollars, usually it's white, usually it's male, usually it's English speaking. Not only in the United States, across the globe. So sometimes I wish the systems would just back down and become vulnerable, because at the end of the day, who makes the systems? The systems are not an intangible thing. They're built by people. The systems that we reside right now in this era were built by people before our time. So they're not static, they're flexible. They don't want to move because they don't want to lose power. And if you think about it, it's not a crazy idea. Nobody wants to lose power. But if systems rely on workforce from people, rely that people is healthy to provide work that will, you know, also sustain the system. System needs to become a little bit smarter, that they don't want to kill their host, right? They need to support families. They need to support the communities that they reside in, even if it's not for the goodness of their heart. It's a transaction. And for us, working with healthcare systems and you are inside of the healthcare system, Corinda, and you know how difficult it can be to break the red tape, to make people change their minds, because the only way that we can change our minds is by being exposed, is by walking the walk with somebody else's shoes, or being or having an internal transformation that has taken us through a journey of seeing the other as my neighbor. So in order for us to leverage, systems need to lose power, and communities need to amplify theirs. And I don't know, you know, a utopian thought is not something that is never can be achieved. It's something that has never been tried, because it was utopian, you know, for human beings to go to the moon, and it became a reality. Why? Because it was investment, because it was innovation, because it was countries together working towards a goal. So we are looking at changing the lifespan, the life expectancy of women and children of color, of white women too, because white women bodies are also harmed in the maternal health, not at the degree of brown bodies, but they're still women bodies, right? That are deemed not as great as male bodies. When we're talking about, you know, the binary men and women, you know, we understand that, you know, the diversity that exists. But it's important for us that in the leveraging, we become honest with each other, we become human with each other, we become vulnerable with each other. And sometimes leadership needs to shift sometimes people need to say, I'm not the leader that this organization needs anymore. I will step down. Could be organization, can be a community association, it could be a board. And communities need to start organizing and having the funds to be able to organize in bigger and brighter and louder ways. Because change can happen when people organize. It has happened before. But I think that a lot of the schemes of divide and conquer, that it has keep us too busy for us to really organize in a way that is meaningful, that is highly connective and collective.
Thank you, Mariella. So with that, we're gonna give you Brandy and then Ashley, and then we're gonna ask you if you can stick to a minute. That would be great.
I'll try. I would just say the best way for healthcare and other systems to partner with community-based organization is to allow them to lead. I think that's part of the challenge with partnerships, is that power dynamic that we often talk about. I have a perfect example of a relationship that Urban Triage has with MMSD. It's not with the whole school system, right? Because you can't have a relationship with the whole school system. It gets a little complicated. However, we have this one access point, and her name is Laura. And she's the head of social work, and she is our direct access point. So she's able to support us in navigating MMSD to provide our students with what they need. So Urban Triage are in the schools. We're able to work together to write grants and systems. When you approach them at this huge, like as the actual system, it's going to be messy. You have legal problems, everybody about policies and procedures, nothing gets done. But if you can get one person like Shiva Bedard that will help you navigate that system and connect you with the right person, then you can have that synergy, right? Because as others have said, systems are made up of people. So you have to find the right people in the systems that get what you're up to and help you navigate. So that's what I would say.
Thank you. Ashley.
I would just say, with all these partnerships, to leverage all the various partnerships to reduce racial health disparities, I think first we have to acknowledge that there are racial health disparities, and that would be the first step. And then to communicate about that, openly and honestly, and to be willing to listen to one another. And I think, we're not going to get anywhere if we can't first acknowledge it and then actually communicate about it. I'll just say that.
So I want to thank you to our panelists, Ashley, Brandy, Mariella. You guys did a great job today answering some of these tough questions. And we want to thank you for the work that you do on an everyday basis, helping those most impacted in our communities to be able to live better lives. And so with that, I'm going to turn it over to Juan.
Thank you so much, Corinda, for your time. Thank you, panelists, for your time and for sharing all of your valuable advice and outlook on all of these very important topics. If you did submit a question that didn't get answered, we do plan on answering those questions and adding them to our next Lead United newsletter in March, which we will forward to all the participants today. Often, our most common question from donors is, how can I help? So you can make a difference by giving, advocating, and volunteering. To give means to continue to give at the Lead United level. And if you aren't a member, consider joining Lead United through our Step Up program to grow your gift over 3 years. Advocate, so please share what you learned today, any key takeaways, friends, family, team, work, coworkers, strangers on the street, anybody that you can come in contact with, just please share what you've taken away today, as it is important to spread the message. And then volunteer. Molly will drop a link in our chat, so you can save the date for some exciting upcoming events that we have. There's also Trivia with Link, and Link is our volunteer-driven affinity group that focuses on issues in our community while providing a space for connection and socialization. At Trivia, we'll also be hosting a donation drive for Urban Triage and provide food, cold weather items, and toiletry essentials for families that they serve. Join us for our community celebration luncheon on March 1st to celebrate our collective impact. The deadline to register is in 2 days, so please make sure to register as soon as you can. And we will have a lot of great services and programs in our community, but we're better together is the message that we want to send. That's why United Way coordinates efforts across the community, collaborating with hundreds of local nonprofits, businesses, volunteers, families, and you to address big picture issues like these. No one person or organization can solve these issues, so it really is a collective. Thank you. Please consider filling out the short survey at the very end here. And we do want to hear more from you, our donors and advocates. So if you can bring um, your feedback, we would love to make more engaging content like this. Thank you all again for making this work possible. And we hope you enjoy the rest of your day. Thank you.